Hi, I'm Bo Kennedy. I'm an emergency pediatrician in the emergency department at St. Louis Children's Hospital and Washington University. And I wanted to talk a little bit today about thinking about gun violence as a public health problem and trying to apply some of those principles and to try to find common ground with people that have worked hard to improve the lives of our children, whether it's in cars or vaccinations or other problems such as cancer. Approximately 40% of American homes own a gun. And I think this is because guns are perceived by many as providing some sort of protection in the case of an assault. But in fact, the data that we have suggests that they carry very significant risks with them as well. So what do we know from these studies? We know that in homes with children younger than 18 years of age, the homes that have guns, 22% store the firearms loaded, 32% store the firearms unlocked, and frighteningly, almost 10% store the firearms unlocked and unloaded. A study in northern Alabama found that despite what the parents believe, the children in these homes know that the guns are there, they know where the guns are, and they have played with the guns while the parents have been absent. The parents aren't aware of this, but even their children less than 10 years of age were frequently acknowledging that they had played with the guns. A study from Chicago looked at 64 different guns, handguns that were purchased legally, and found 25% of 3 to 4 year old children were able to pull the trigger, and 70% of 5 to 6 year old children were able to pull the trigger. So how does this impact us from a public health standpoint? Well, as of mid-October of this year, 43 cases have been reported of a toddler 3 years of age or younger finding a gun and shooting somebody. 43 in this year alone. In 31 of those cases, the toddler shot himself or herself. It's usually a boy. Here in St. Louis, a 21-month-old recently found a loaded handgun in his grandmother's house and shot and killed himself. Earlier this year in Michigan, a 3-year-old found a handgun, a .40 caliber handgun in a closet while his dad and his brother were outside working in the yard. He shot himself in the head and died before the rescuers could arrive. An increasing number of guns in our children's environment are resulting in increasing catastrophes with these firearm-related injuries. As many of you know, recently here in St. Louis, a University City boy was killed by his 11-year-old friend as they played with a pistol found under his grandfather's pillow. A 2-year-old boy was paralyzed when his father accidentally discharged his gun during loading. A 5-month-old girl was killed by her father's pistol when it fell out of his coat as he was putting her into her car seat. These are all St. Louis stories. A 4-year-old boy found a handgun at home and placed the barrel in his mouth and pulled the trigger, as he'd often done with his water pistol to get a drink. Unfortunately, firearm safety training is not enough to prevent these tragedies. A study in Atlanta found that children with firearm training had been just as likely to find a gun during play and to pull the trigger. 64 8 to 12-year-old boys were observed in pairs or 3 or 4 at a time behind a one-way mirror in a room that had a desk in it that had a .38 caliber handgun that had been inactivated but hidden in the drawer. 72% of these boys discovered the gun while they were supposedly waiting for something else. 48% pulled the trigger. 90% of those who handled the gun or pulled the trigger had had previous firearm training. These are children, and I think that's one of the things we have to recognize. We don't give driver's licenses to 8 to 10-year-old boys for good reasons. They don't have the frontal lobe wiring connected yet to be able to have the kind of judgment that's needed to be able to handle a firearm. In 2013, the latest year that we have the numbers, 1,670 American children, 19 years and younger, died by gunshot. That's about 5 a day. An additional almost 10,000 were injured. This is 2 times the number of children that died from cancer, 5 times the number that died from heart disease, and 15 times the number that died from infectious diseases. These are public health problems that we have attacked with a lot of research. This is the equivalent of more than 80 Newtown shootings every year where children are dying from firearm injuries. The 2007 repeal of the permit to purchase law, handgun law in Missouri, has been associated with a 23% increase in homicides since that year in our state alone. Missouri is one of 17 states now that have more people dying from gun violence than die from motor vehicle crashes. Our cars and roadways have been made safe by our research that's led to seat belts and shoulder harnesses and car seats and booster seats and airbags. These have dramatically reduced the likelihood of a child being killed in a car crash. We need to learn to apply some of this to the gun violence situation. Our research has helped us determine that these car seats are safer for young infants if they're in the rear seat and facing backwards. We need to understand better how our children are being injured and killed by guns in a similar fashion so that we can develop methods to reduce or prevent these tragedies. And in terms of providing safety, a study in Seattle found that having a gun in the home was related to a 3 times increase of that gun being used against somebody the homeowner knew or against himself than it was against an intruder. 3 times more likely to be used against somebody you know than against an intruder. A study in Philadelphia found that if you were assaulted and you were armed with a handgun, you were 4 times more likely to be shot than if you were unarmed. So I don't know that it's providing much attention from what data that we know, or much protection from what data that we know. Of even greater concern is that a gun in the home has an increased likelihood of 5-fold of being used in a successful suicide. About 90% of successful suicide attempts are successful with a gun, compared to 3% with other popular methods such as ingestions and so forth. The studies show that 2/3 of those who attempted suicide did not plan their attempt. Interviews with survivors of near-fatal suicide attempts found that 3/4 of suicide attempts occurred within an hour of making the decision to commit suicide. These are impulsive decisions for most people. There are studies that have shown that reducing ready access to guns has significantly decreased the likelihood of suicide, particularly with firearm-related suicide attempts. Of the survivors, 70% who attempted suicide never attempted again. Only 7% eventually killed themselves. This suggests that if we remove that gun from immediate access, that it dramatically reduces the likelihood of successful suicide. The thing that's important about understanding the suicide issue is that twice as many people die from gun-inflicted suicide as die from accidental or intentional shootings. And that's a startling statistic that I think we need to really begin to think about as well in terms of public health. This is not just street violence. Firearms are used in almost half of these cases. And in almost all, 84% in one study, of these guns belong to a family member of the patient that committed suicide with the gun. One study in Pennsylvania found that having the guns locked up didn't make a difference. These are older teenagers, young adults that can get access to the guns that are locked up. Just simply having the gun in the home increased the likelihood of successful suicide 5 times. Mental health access is certainly an important issue in regarding to reducing gun suicides and homicides. We recently had a tragic shooting in the quiet suburban Glendale, where I live, when a depressed mother killed her 10-year-old son, her 8-year-old daughter, and then herself. And just within the past few weeks, in the city next to St. Louis, a grandmother killed her 6-year-old daughter and then herself. And these are impulsive decisions. Just as with many adults, a study found that 40% of suicide completers under 16 years of age, so these are teenagers and older school-age children, had no known psychiatric disorder. This means that they had not accessed our mental health system. Perhaps with a better screening, we might be able to identify these children. But 40% had no known psychiatric disorder. In these children, having a loaded gun in the home increased the likelihood of suicide 32 times. Since 2002, St. Louis Children's and Cardinal Glennon Children's Hospitals have cared for 1,781 children injured or killed by firearms. 35% of these were younger than 15 years of age. That's about 70 children each year that we're seeing at St. Louis Children's Hospital and a similar number at Cardinal Glennon Children's Hospital. So my challenge is, in much the same ways we've approached injuries to children from automobile crashes, from infectious diseases, from tobacco, viewing firearm-related injuries as a public health problem can help determine underlying causes, effects, and outcomes, and help us develop methods that can reduce the impact of the gun violence is having on our children. Thank you.